How are we doing?
Can y'all hear me? Can you hear me now?
Yes.
Okay.
Yes.
Somebody
Yes.
fire up and make sure she coming. I seen her still on the other live stream. I ended it, but she got the link, but she probably still. But it's not up here. Yeah, she got it. Oh, she ain't paying attention, y'all. Oh, she coming. Okay, Oriate, we live on Zoom. What up, though? Come through, Trish. Come through. All right. Okay, come through, Felicia. Come through. Tavara, you see us? Come on, girl. I'm sorry for the technical difficulties, but what up, though? What up, what up, what up, though? Let me show you what I look like. Hey.
Bring it on. Bring it on.
I know, right?
Bring it on.
Come through, Kim.
What? Got that bun up there. I see it.
Tavara. Not the smoke signals. Come on, Tavara. Come on, Tavara. All right. How y'all doing? Y'all, listen. I ain't got time. We will not be defeated. Please reach out. Tavara. Come on, Tavara. Come on, Miss Franklin. She still was kicking it on the other
I'm
one.
sending her a message. I'm seeing if she'll answer.
Thank you very much. Let's see if that can catch her. But if y'all sit out here watching, y'all go ahead and tell her to come on so we can get it on and popping. I just want to thank you guys for coming in and rocking with us today. We are coming into you to bring you awareness to mental health. All right, bring more awareness to mental health. And today we're going to talk about obsessive-compulsive disorder. So before we even get into it, I am going to introduce my beautiful panel, but at this moment, we're going to wait a second because I'm missing one of my lovelies. And got to get Miss Juana to come on back on screen, and then we can, there she is. All right, thank you, Miss Juana. All right, tip your camera a little bit, Miss Juana. Yeah, that way, babe. Thank you. All right, and yes, baby, I gotta get all of that in there.
Yeah,
all of that.
That's looking good. That's looking good right there.
Okay. Somebody send out my smoke signals to Miss Tavara. All right, y'all. So we're bringing you guys today for one, again, I want to thank you for joining because we are all licensed professionals and we want to, as much as possible, bring awareness to mental health and let you know that it is help out there. And then it is ways that you can support your family members or your friends if they are suffering from mental health issues. I am Glendora Divine. I'm a licensed professional counselor. I'm board certified in mental health. And I am one of the best business coaches out here too, mental health clinicians. I love to help mental health clinicians build, scale, and grow their private practices. I want them to be sustainable, profitable, and marketable. And so that's what I dedicate myself to, as well as counseling. All right. So when I counsel, I deal with EMDR and CBT when I help people heal. So that's a little bit about me. I'm going to allow Miss Felicia to come on in and introduce herself. And please, Felicia, tell us, of course you are, what state you're going to represent today And girl, your smile is on fire. Thank you for coming in with all of that. And I'm going to jump off screen because I had to go send out the smoke signals for Ms. Tavara. And so Felicia, once you get done, please, Ms. Lyles, take over and I will be back after that.
Glendora,
Yes.
I just hung up from her. She's coming in there.
Oh, thank you. Thank you. Thank you. Look at the smoke. Look at the smoke. We bring the smoke. All right. Well, come on in then, Miss Felicia Cameron, and tell us who you are.
Hi, I'm Felicia Cameron. I'm a licensed clinical social worker for the great hospitality state of Mississippi. And I'm also the owner and founder of Lend a Hand, where I provide transformation to my clients to provide them the tools, the techniques, to help them cope with life, whether that's dealing with anxiety, depression, or just coping with life transition. Look, I'm so excited to be here. We were delayed a little bit, but guess what? You in store for some great news about OCD and all the different diagnoses are related to it. So I look forward to talking to you when it to my session. Pass the mic on to Glendora for the next person.
All right. Thank you, girl. Thank you, girl. Come through. All right, Ms. Lyles, tell us who you are and what you represent.
I am Juana Lyles, licensed professional counselor and owner of LIT Wellness Center. That is Live Intentionally Today Wellness Center. I specialize in trauma, anxiety, and depression. My expertise is in brain spotting, CBT, and preparing rich for couples, okay? I serve individuals and couples that are ready to start living and stop just surviving. I equip you with the tools that you need in order to learn, love, and live again. Y'all, yesterday is gone and tomorrow is not even promised. So why not live intentionally today?
Amen. Amen. Okay. Today, intentionally. Come on, Ms. Knowles. Tell us who you are and what you represent.
Let me tell you, all this energy this morning, I'm trying to pull up, muster up some energy for this Saturday morning at 10 a.m. But my name is Trish Noel. I am a licensed clinical social worker. I am the founder and CEO of Noel Integrated Services Incorporated. NIS provides behavioral health and addiction counseling services to individuals, families, and groups seeking healing from the challenges of life. NIS uses psychotherapy, providing practical tools to those on a journey to better health and wellness. So through solution focus, through CBT, definitely we're about just being on the journey together. So on that note, I'm excited to be here. I'm ready to do this. And throughout the technical difficulties, here we are.
Here we are. Tear, get up out of here. All right, here we are. And come on, Miss Oriente. Say it like that, y'all, because that's how I say it. Oriente.
Good morning, everyone. I am Oriente Nicole Eisen. I'm the founder of Emerging Spirit Counseling Services in Cincinnati, Ohio. I'm dually licensed in both Ohio and Kentucky. I specialize in individual and family counseling for children and women, helping them to promote safe and healthy lifestyles. And I have been working with people to help them change, heal, and grow for over 20 years through therapeutic counseling interventions.
Okay, come through, Miss Eisen. Dually licensed in 2 states, Ohio and Kentucky. Emerging Spirit. Okay, and come through. All right, Miss Tavara Franklin. Get in here.
Good morning, everybody. We apologize for the technical difficulties, but we are here and we're ready to serve and give you guys this information. Okay. So again, my name is Tavara Franklin. I'm a licensed professional counselor. I am the owner of Healing Grounds Therapy and Wellness Center. That is where we are cultivating hope and healing back into your life through honesty, openness, transparent. That's us being hot. Okay. Not only I am your licensed professional counselor, but I am your healing accountability partner. I have a specialty in seeing young girls and women from the ages of 13 into adulthood with challenges of anxiety and depression. And I have an expertise in cognitive behavior therapy as well as reality therapy. We are looking forward to giving you this information. So I am ready to just dive in and bring it to you guys. Good morning. Good morning.
Hey, with no further ado, again, we are truly appreciative that you guys are tuning in. I want to give a special recognition to our sponsor, the Honorable Mayor Ann Tarpley of Hampton, Georgia. We thank you for this opportunity to highlight mental health awareness in the city of Hampton, and you honestly sponsoring us. We really, truly appreciate that. And I hope you guys were paying attention to the name of these agencies, because honey, we are on and popping, from Noel Integrated Services to Lit Wellness Center to Healing Grounds Therapy Center to Lending a Hand Counseling Center to Emerging Spirit Counseling Center, and of course, Divine Systems. We got all these systems working together up in the state of Georgia. Come through. All right. So let's get into it. What is OCD? Obsessive-Compulsive Disorder. You know, I really wanted to bring awareness to this disorder because we, in our community and culture, we really kind of like play it off. We kind of like make jokes about it. We don't really take it serious. And ladies, if you don't want to be on camera, and when you're not speaking, that's fine. So you can go ahead and black yourself out, and we'll just highlight the person that's going to be talking at that time, so we can make sure everybody stay focused. Okay. So we honestly, we shrug it off. We don't really, give much attention to it. And we really don't know how to support our family members or our friends when they are suffering from obsessive compulsive disorder. And this disorder starts off small and it gradually grows over time. So with that being said, let's get into Miss Oriente Eisen, who is a licensed professional counselor, and she's going to tell us, what is OCD, Oriente? What is it?
Thank you, Glendora. So OCD, Obsessive Compulsive Disorder, is characterized by unreasonable thoughts and fears or obsessions that lead to compulsive behaviors. These obsessive thoughts or obsessions lead to repetitive behaviors or compulsions. OCD often centers on themes such as fear of germs or the need to arrange objects in a specific manner. Symptoms usually begin gradually and vary throughout life. To diagnose it is sometimes very difficult. OCD symptoms, because the symptoms can be similar to those of obsessive compulsive personality disorder, anxiety disorders, depression, schizophrenia, and other mental health disorders. And it's possible to have both OCD and another mental health disorder. You need to work with your doctor so that you can get the appropriate diagnosis and treatment. This is usually done by a psychological evaluation as well as a physical exam from your doctor. All right, are we going to go ahead and go into the treatment, Glendora?
Well, I want to ask you, when you said OCD is usually, or it could be with another disorder, like what disorder do you think they may be paired with sometimes?
Where a person could be suffering from both depression and OCD at the same time. A lot of times people are suffering from anxiety and OCD because when you're, experiencing these obsessions and these compulsions, you get anxiety because most people don't want to have these things. So a lot of times the anxiety comes from them trying not to do it and trying not to let other people see them do it. And as an example, I knew somebody that basically their OCD thing was every time they left the house, they would have to check the door. And that's like turning the knob a certain specific amount of times. And if for some reason they felt they did not do it, say the number was 15, if they hadn't turned that knob exactly 15 times, they would have to start all over again. And not only this person has left their house before thinking, okay, I can't remember for sure if I counted 15 times, and literally left their job to go back home to check that doorknob to make sure it was locked and that they turned it 15 times.
So that's like a really disruption of like her day or that person's day if they literally have to leave their job to go back and check that. So obsessive compulsive disorder is something that really will disrupt your normal routine, is what you're saying?
Well, it can. And that's when you know that whatever your disorder is, whatever your mental health condition is, when you know that it is a compulsion or it's something that needs help, is when it's at the point to where it's disrupting your regular routine in your life.
Okay. All right. So yeah, definitely, like, now tell me about the actual treatments that's available for obsessive compulsive disorder.
Okay. The two main treatments for OCD are psychotherapy and medications. Often treatment is most effective with a combination of these. For psychotherapy, cognitive behavioral therapy, which is a type of psychotherapy, is effective for many people with OCD. Exposure and response prevention, a component of CBT therapy, involves gradually exposing you to a feared object or obsession, such as dirt, and having you learn ways to resist the urge to do your compulsive rituals. ERP takes effort and practice, but you may enjoy a better quality of life once you learn to manage your obsessions and compulsions. Certain psychiatric medications can help control the obsessions and compulsions of OCD. Most commonly, antidepressants are tried first, the most common ones being Prozac, Paxil, and Zoloft. However, your doctor may prescribe other antidepressants and psychiatric medications. In general, the goal is to effectively control the symptoms at the lowest possible dosage. It's not unusual to try several drugs before finding one that works well for you. Your doctor might recommend more than one medication to effectively manage your symptoms. In choosing a medication, the goal is to effectively control the symptoms at the lowest possible dosage. It's not unusual to try several of these. Some of the things to keep in mind when you are trying psychiatric medications are potential side effects. Always talk to your doctor about any side effects that you might be experiencing. And then also suicide risk. Most antidepressants are generally safe, but the FDA requires that all antidepressants carry what's called black box warnings. These are the strictest warnings for prescriptions. In some cases, children, teenagers, and young adults under 25 may have an increase in suicidal thoughts or behaviors when taking antidepressants, especially in the first few weeks after starting a new medication or when the dose has changed. If suicidal thoughts occur, you need to immediately contact your doctor or get emergency help. Keep in mind that antidepressants are more likely to reduce suicide risk in the long run by improving your mood. Other things to take into consideration would be interactions with other substances. While taking antidepressants, talk to your doctor about any other medications, prescriptions, over-the-counter medications, herbs, or even supplements that you might take, because you never know when they might have an interaction with your medication and cause dangerous reactions or side effects. When stopping antidepressants, you have to consider the fact that they can be addictive, but sometimes physical dependence, which is different from addiction, can also occur. So by stopping treatment abruptly or missing several doses, it can cause withdrawal-like symptoms, sometimes called discontinuation syndrome. Don't stop taking your medication without talking to your doctor first, even if you feel like you're feeling better. You may have a relapse of OCD symptoms. Make sure you work with your doctor to gradually and safely decrease your dose. There's some other in-treatment resistant things. Intensive outpatient and residential treatment programs should be used. You can use deep brain stimulation and also transcranial magnetic stimulation.
Okay. So what I'm hearing you say is that, y'all, she's saying medication is a good treatment for OCD as well as psychotherapy, right? And who knew Zoloft or Prozac was used to treat obsessive-compulsive disorder? You know, the first thing you think is that person is, oh, you on Zoloft, you're depressed. But good thing to hear that sometimes Zoloft or Prozac is used to help control the symptoms related to OCD. And the biggest thing that she wants you to remember, I think I heard, is listen, don't just stop taking your medicine because you start to feel better. You can feel worse because OCD can rear back up. It'll start back again. The treatment that you said, Oriente, was cognitive behavior therapy and exposure response prevention. That's a form of cognitive behavior therapy, correct?
Yes.
So if we have a family member or friend that is suffering from obsessive compulsive disorder, any form, and we're going to go over 2 other forms in just a minute, then we should be seeking out a therapist that does specialize in cognitive behavior therapy, correct?
Yes.
And if she's or he, the therapist, is in cognitive behavior therapy, it's okay for you to be the client, the family member, the friend, to ask them about ERP, which is, again, exposure response prevention. And it's a form of treatment that is connected with cognitive behavior therapy. Now, if you are a mental health clinician, I am going to drop in after we get done, 2 trainings on exposure response prevention. And so if you're interested and you want to learn more about it so you can do better treatment when you are serving someone who is experiencing OCD, here you are. Here it go. I'm going to give it to you because I want you to be your best so we can help these people heal and support them. So speaking of that, thank you so much again, Miss Oriente Eason. I'm sorry, Eisen. Miss Oriente Eisen, get myself together. Miss Oriente Eisen, emerging spirit, listen, emerging spirit counseling. You guys, I'm going to make sure that you all have everybody's information too, because we all are resources for you. Okay. We all provide telemental health services so we can service you. And if we cannot, we will find someone that will. So in the chat, that's going to be there as well. So thank you again, but let's get into what are the symptoms of OCD, obsessive compulsive disorder, and how do we cope with obsessive compulsive disorder? So with that being said, come through, Miss Felicia. Felicia Cameron is going to come through and highlight us about the symptoms, what to look for, okay, if you are experiencing OCD and how to actually cope. Okay, here we go.
So what are the symptoms of OCD and how to cope? I want you to listen with me. Jennifer, one of my clients named Jennifer, that's not her real name. Jennifer is an African-American woman. She's in her 40s and she also a veteran. But Jennifer, she has a secret that she's been keeping for a long time. Recently, her partner moved in with her and that partner knew about her secret. I've been working for Jennifer for months. And Jennifer knows this secret. She can't get fully the treatment she needs in psychotherapy counseling unless she let me know. But Jennifer, she was afraid or really didn't want to admit this secret because the stigma that's associated with it. And Jennifer finally told me after months of working with her, the secret that she's been dealing with. Do you want to know the secret? Jennifer has OCD. She has OCD. Yes. Jennifer's secret caused her to have problems sleeping at night. Her sleep is constantly interrupted. Jennifer gets up several times at night to check the doors. We actually did like a log for her to count how many times she get up. On average, Jennifer get up 8 to 10 times to check and recheck her doors. And not only does she recheck her doors, but there's a certain order, specific way that she go check these doors. And even when Jennifer is sick and not feeling well, her partner who lives with her, she she encouraged him and stressed for him to go check the doors a specific way in a certain order. This checking and rechecking doors, yes, it caused her to not have sleep. And the reason why Jennifer do this is, she mentioned to me, is that she want to make sure that no one come in on her, because Jennifer was a victim of sexual assault while she was in the military. And so her checking and rechecking doors is her way. And so what are the symptoms of OCD? It's a strong fixation, strong focus. Whether you focus on, fixation of dirt or germs, or focus on fixation of things being a certain order, meaning that all the cans got to line up a certain kind of way with the label face a certain way. Repeated doubts in your head, or repeated doubts. Did I check the door? Did I let the garage down? Did I turn the water off? Repeated doubts in your head that it interfere with your day-to-day life with school or work. It's repeated acts, like you can constantly hand washing, constantly rechecking and checking doors, or turning things on and off, even having very rigid rules that you follow. Like, after I do this, check the door, I go to this corner and check this door. Very rigid rules. But what are some coping skills? I want to give you 3 coping skills. One of the ones I used with Jennifer, we did like a journal where she tracked her triggers, tracking your triggers of what the situation, what was going on at the time, tracking those triggers, and then turn around and presenting those triggers. Once you track those information, present it with a therapist. Oriante was talking about some of the treatment is medication, and also I stress psychotherapy. Medication can only do so far, but psychotherapy with the combined together can really help. So using that journal to talk it out and work through the process with your therapist. Another coping technique is refocus. Refocus your attention. Meaning, before you get ready to have those OCD triggers or urges, try to refocus your attention to delay it for 15 minutes before you go into that routine that you normally do. For instance, refocus your attention to, like, okay, I'm going to exercise for 15 minutes. I'm going to go walking. I'm going to go listen to music or read before I go recheck the doors. Let's refocus and delay our response to the OCD. Third, practice relaxation techniques. Whether that's deep breathing, being mindfulness, or meditation, or relaxing your muscle. Thank you, Glendora. And I want to say, we all got to do life, but don't let life do you. You have any questions?
Yeah, yes, I do. Please talk to me for a second, Queen. I am going to ask you, because I really like the whole fact that you said that in a way to cope. First of all, you say one of the symptoms. So basically it's the repeating negative thoughts, so they are negative. Some of them are, right? So, but it's intrusive thoughts. We can't like shake them. We can't like make them go away, right? So they just keep hitting us, right? Okay, and they're repetitive, point blank and period. They just keep coming and coming and coming and coming, correct?
Correct.
Okay, so when they keep coming, you saying to stop it is to go ahead and refocus that attention. So when that thought hit you, did I check the door? Did I check the door? Just automatically stop right there and say, okay, I'm repeating myself. Did I check the door? Let me go and do 3 squats right now. Is that what you mean when you say refocus?
So what I'm saying is like that thought comes, did I check the door? Did I check the door? Before I go to that response to go check the door, I'm going to pause and I'm going to set at least a mental timer or my phone for 15 minutes. For at least 15 minutes, and I'm gonna do something else to delay me going to check the door. Okay. What I mean, like I'm gonna do 15 squats, or I'm gonna listen to music for 15 minutes, or I'm gonna read. But before I go to my normal, the behavior I think I'm going to, let me do something for 15 minutes to delay me doing the OCD behavior.
Okay. And then the other thing is, you said track how many times or what the actual behavior that you're doing that is the OCD behavior. So that wouldn't actually be the thoughts that I'm having. That'd be me physically trying to go check the door. Is that what you're saying?
So I'm talking about actually tracking, like, okay, to see, how many times am I really doing this? Sometimes we think, oh, I'm only doing it for a few times, the person dealing with that. But when you actually go in and track, no, I'm actually checking the doors 20 times to help you to come to, oh, I really have a concern that if you're not seeing a therapist, then I need to bring it up. I actually check the doors 20 times. And what is going on in my mind, track if you want to even add a detail in your log, tracking out what is going on at that time. But you actually really tracking down what's the triggers, what's the situation surrounding it, and how many times.
Okay, so like when we track, a lot of us is not using pen to paper now. We're using our phones. So are you literally saying just go into the note screen in your phone and just keep a record right there?
Yes, you can use pen and paper, or there's many apps, or just simple. Put it on your phone.
Okay. Okay. All right. So that's a big deal. And you really were advocating for psychotherapy. So with OCD, you really feel like it's nothing that you should really just try for yourself. If you have a family member and maybe you start to track them and they don't know, but you just keeping a record on your phone, how many times you see them repeating this behavior, would you suggest that family member come with that person to therapy to try and help get this point across that, you are being a little obsessive? Or how would you try and get the family to support the person in that situation?
Actually, I did have that to happen. Working with one of my clients who is a school teacher, and the spouse knows how very rigid ordered how they do things at home, and they just thinking that's just part of their normal thing until that spouse begins to start tracking, and then mentioning to them about concern, and actually having that client come in with their spouse. So, the person family member who, come in as a counseling, as a support, that actually can bring a different perspective about what they have noticed too, because sometimes the people with OCD, some of them don't think it's really as a problem. This is normal. It's normal that all my cans line up a certain kind of way and the label be turned a certain way. For instance, that client, when they go to the grocery store and they buy items and put it in their pantry, everything got to be turned a certain way. And if it's off a little bit, they tell the spouse that live with them. And so they start noticing. So having that person, that support person, family member, coming to counsel if they can, to also help out, especially if they're living in the same household, because, we think about just that person, but if you're living in the same household, OCD affect the people living in that home. And they got to know how to cope with that too.
I agree. So that support is really there. And a lot of times the support look unsupportive because it sounds like, why is you always doing that? It don't really matter. And stop doing X, Y, and Z. And it turns into arguments and confrontations and is unsupportive. And the reality of it is, if them cans is not turned that certain way, they just truly don't feel good in the inside. They don't feel right. And that is why medication and psychotherapy together helps. You agree?
I agree.
All right. Please don't disappear on me, because I need to know about how to lend my hand one more time. Okay. But right now, y'all, let's get into other related disorders connected with obsessive-compulsive disorder. What are you talking about, Glendora? I am going to talk about hoarding. Y'all be watching that television show. Y'all seen that. How do people come with how do hoarding happen? Okay. What is hoarding? Hoarding is a form of obsessive-compulsive disorder. Okay. And we're going to listen to the Miss Beautiful Tavara Franklin. Hey, Healing Grounds is all about it. Come through, Tavara. What's hoarding?
Everybody. Listen, I'm thanking Glendora. This is such an amazing topic. And again, I feel as though it's great to highlight, because y'all know with mental health, there's a lot of trending things that's associated with it. And, you know, certain things they'll say, oh, my OCD, that's my OCD. But we really need to be able to have this topic so people will understand what is really true OCD. But also there's other things that are associated with OCD, such as hoarding. And hoarding is a type of OCD that's associated with hoarding. So let's just get into what hoarding is. Hoarding is that persistent, you know, intrusive thought and compulsive behavior around acquiring certain possessions or any kind of possessions, and they're really having some kind of difficulty in discarding those things regardless of the value. So again, those two types of behaviors that hoarding is associated with is that obsession and that compulsion. So what do you mean, Tavara, what do you mean by obsession? So an obsession example could be a person might believe that they can't get rid of this greeting card from a classmate that received it 10 years ago because something bad might happen if I throw it away. Or they might have a thought of, well, 6 is my lucky number. And so that means I need to be able to get 6 of this certain item or 6 of this other item, because if I don't, something bad will happen. That's an obsessive or intrusive thought of hoarding. The other component is that compulsion, that compulsive behavior. So you might be holding on to possessions like clothes because you fear you might need them in the future, okay? Or you might be holding on to unnecessary paper like receipts because you feel as though that you might need it in the future. Or you might be storing like a surplus of items in your home, like pencils or notebooks or you know, water, you know, anything that you could think of as far as a surplus because you fear you might be running out. There's actually in the DSM-5, there's two separate diagnoses. You have hoarding OCD and you have hoarding disorder. So let me just break down to you the difference between them. The difference with individual with hoarding disorder, they accumulate all these items because they think they are valuable. So people with hoarding disorder find value in possessions and they want to be able to keep them, and they experience some kind of distress or when they're forced to like have to throw them away because they don't want to sacrifice the fact that it could be valuable to them. Whereas people with OCD related hoarding is generally because of unwarranted responses and these excessive thoughts and anxiety that's associated with it. So people with hoarding OCD, they typically have their these possessions that are very, very, you know, stressful for them, and they're unwanted, and they don't really want them, but they have no control over the actual thoughts and the compulsive behavior and obsessions are guarded. But they feel like that something bad would happen if they really disregard it. So when a person hoards, they are essentially holding on to the item because they feel like it's essential to their identity. So they feel like this item is a central part of their identity, such as like these greeting cards or such as these artwork, paintings or souvenirs or invitations, you name it. So a person with, you know, OCD, hoarding OCD, they may fear if they lose this, then they'll lose their identity. I hope that kind of makes sense as far as like the difference. In addition to that, hoarding OCD, there could be purchasing rituals that's associated with that. So again, it could be as who done said that? Felicia stated that sometimes with OCD, there's like a person believe there's a specific number they have to go by because of that obsessive or that compulsive thinking. So with hoarding OCD, it might include having those certain rituals or certain purchases that have that particular number. Again, as I stated in my example, if that person believes 6 is a lucky number and 6 if I don't obtain 6 of something, then something's bad is going to happen. That's what I mean by that. It's that particular behavior. As far as treatments are concerned, we highlighted some of those treatments. So let me just kind of reiterate and highlight that the most popular treatment for hoarding OCD is that exposure and response prevention therapy. So the idea of that is having that repeated exposure to those obsessive thoughts without engaging in the compulsion. And this is the most effective treatment for OCD. So when you're continually, reaching out for these compulsions, it only strengthens your need to engage in them. So, but on the other hand, when you prevent yourself from actually engaging in these compulsions, then you're teaching yourself a new way to respond, and you are very much more likely to experience and notice a reduced anxiety associated with that. Another treatment that is effectively great with OCD or hoarding OCD, that is that motivational interviewing. And all motivational interviewing is involving in exploring any kind of uncertainty a person may have about acknowledging and changing their hoarding behavior, and they're tapping into those natural motivations for them to change. Another infamous treatment for hoarding OCD will be that my favorite CBT. That's cognitive behavior therapy, where you're focusing on dealing with those thoughts and those emotions that lead to that behavior. And a person with CBT, a person learns to identify what those thoughts are and those beliefs that's triggering them and that's making them, save or accumulate all these items. The other doses with that, again, these are all psychotherapy related modalities. So people will couple that with medication. However, there isn't a specific medication with hoarding OCD. However, because again, that research is still trying to obtain, what kind of medication will work for that. So how you really treat hoarding OCD is thinking about some of those co-occurring disorders that's associated with, such as anxiety, such as depression. And so they'll couple that any kind of medication that's utilized to treat that, such as Zoloft, to really help decrease some of those symptoms that you may see in hoarding OCD. Again, my name is Tavara Franklin. I'm a licensed professional counselor in the state of Georgia and owner of Healing Grounds Therapy and Wellness Center, where we are cultivating hope and healing back into your life through being honest, open, and transparent. That is us being hot. And I'm hoping you guys are enjoying this segment, because I am learning so much about this OCD stuff. And so that's my segment on hoarding. Tell me what y'all need to know. Let me hear in the chat.
Here I come. Just let me in, because here I come. All right, hot. Okay, tell me about, it sounds like you spoke on the ERP, which is the exposure response prevention, right? Okay, yes. So, and remember, if you are a mental health therapist, I am going to drop some links where you can actually get trained. And I know 2 of trainings that's going on right now for that. But it kind of matched what Felicia was saying about how to try and, identify these symptoms and cope with them on your own. Because it sounded like the exact same thing, before you actually engage in that behavior, do something different. And yes. So you can, then you said, so you can start desensitizing, that feeling that you got connected to that behavior, right? Exactly. So again, she said, refocus your attention and then delay your response to what you would normally do. And that's exactly what you were saying with the exposure response prevention, correct?
Yeah, so like with the exposure response prevention, again, that is us, gradually and repeatedly having that exposure to that thought, because again, there's a certain thought that people have in particular to that hoarding behavior. So again, one of the examples I gave earlier was, oh, well, if I decide to throw away these clothes, then something bad is going to happen, or I might need it again. So it's being able to expose yourself, in that type of compulsion and that intrusive thought, to identify, to really create a different meaning, honestly. If you're continuing to reach out and for that compulsion, then it only strengthens you to really engage in it. But if you're not, if you're preventing yourself from actually engaging it, it's only strengthening the ideal and the thoughts that you have associated with it. So you're not, strengthening a new response to it, if that makes sense.
It does. I just want to just ask you one thing before I let you go. When I watch the hoarding shows on TV, it usually to me be connected with the passing of somebody. When people leave, once they lose a loved one. And, so I have seen the shows where they have like the house is full of clothes. Is this the person that left, that passed away clothes, and they just like, they cannot detach from those personal belongings. And then they will still continue to buy things that remind them of that person. Would you consider that hoarding or hoarding OCD?
So again, the difference between, hoarding and hoarding OCD, with hoarding disorder, you're accumulating these items because you think they're valuable. Okay, so you think that if I throw away these items, then I'm discarding the value of it. Whereas, hoarding OCD, you're accumulating these items and possession over them because they're an essential part of your identity. So you feel as though that these possessions, hold true in who I am as a person, such as when you're looking at hoarders, a lot of them, do go through the process of grief. So some of them deal with the fact of losing a loved one. And so through that relationship, there's an attachment and an identity that's resorted with that. And so they buy these things because they want to be able to hold on to that person. And they believe that, well, if I disregard these items, then I'm disregarding this person. Another infamous thing about hoarding is the understanding the difference between hoarding and collecting. So you might hear people that might say like, oh, I'm not a hoarder, I'm a collector. Well, let me tell you what really the difference is in hoarding and collecting. Hoarding is not the same as collecting. Collectors, they have value in what it is they collect. They believe that when they are collecting a particular piece, they take a lot of pride in it. It's organized, but their satisfaction that's added to what it is they're collecting, and there's a budget in that collection, time and energy. Whereas someone who's experiencing hoarding, there's a lot of shame and embarrassment, and they feel uncomfortable, and they have a lot of clutter. And often when you're coming in the house, the space is not livable. So that's what you're seeing when you're looking at hoarders and things of that nature. And again, there's a lot of shame and sadness that's associated with that. Again, it might be associated with some type of trauma in the past. It might be associated with some type of grief. And because of this, they feel the need to unable to let go.
And that makes sense for why medication for antidepressants might be available or involved in the treatment process. Thank you
Exactly.
so much, Queen. Don't disappear because I
You're
want you to come and
welcome.
say your shout out before you leave up out of here. Okay. Thank you.
Absolutely.
Y'all, let's
Thank you.
hear about what are some symptoms of hoarding, right? And some coping skills to actually cope with this disorder. Then we're going to hear from Miss Lovely Noel, Miss Trish Noel.
Thank you, Glendora. And Tavara did an awesome job because I was like, wait a minute, she was given the information and it was great. So when she was sharing about the difference between the hoarding OCD and the hoarding disorder, I thought I was thinking about one of my clients that I had worked with when I was going out into the field. And with this particular client, the one thing that I realized was that, and you touched base on this a little bit, Glendora, it wasn't about, with her, it wasn't about what collecting just to be collecting, being that this was an older adult, the issue was things that she did not have growing up. Now that she could get it, she would buy in excess. So it could be something as simple as soap on sale. You're the only individual in the house. How many bars of soap do you need? However, she would purchase maybe 10 or 12 of the 12 packs of soap. It could be something as simple as soap. It could be, it was bleach. At times there was bleach, there was laundry detergent. It would be a number of things to the point where it was cluttering the house. And one of the things that I want to share, one of the symptoms is that with hoarding, it's gradual. It's being done gradually. So you may start off, you may see the person start off collecting or having certain amounts of things in the household, but then when it starts to become cluttered, then that's when we're starting to be concerned. Especially like you talk about the show Hoarding. When you walk into someone's house and there's just a path, just enough room for you to get by, then there's hoarding, there's concern. So some of the signs and symptoms are excessively acquiring items that are not needed, for which they're taking up space. Who needs 25 bottles of bleach? Yes, we need bleach, but do we need 25 bottles of bleach? Or who needs, 50 packs of soap, the 12 packs of soap? We need soap, but do we need it in excess? Persistently having a hard time throwing away things. People who are struggling with hoarding, they're not going to throw away things because everything, as Tavara said, is of value. So if this is of value to me, then I don't see the need to get rid of it. And that's one of the things also with hoarding is that everyone else may have a concern, but that person doesn't see it as a problem. That person is seeing it as, this is a necessity. These are things that I need. These are things that, and cognitively they're thinking, I didn't have this. I didn't have that growing up. So now that I can get it, I'm going to obtain as much, because you never know. And it almost reminds me of when the pandemic first started and people were like rushing out to get toilet paper. Now you're getting, 50 packs of 24 toilet paper, but that's not hoarding. But at the same time, it just reminded me of something like that. Another symptom is feeling the need to save things, and being upset if somebody say to you that you need to discard them. To them, this is important. This is of value. And that's the point that we need to see, that these items are of value to this individual. Another thing is the tendency to be indecisive, or, they avoid, there's no planning, there's no organizing because there's too much clutter. And I know sometimes we have to step back and declutter in our own space, and may not even be considered hoarders or hoarding anything. But when there's a lot of clutter around, it's hard to function, it's hard to manage. And when the hoarding is starting to cause distress in your social or in your work environment, then we need to really seek some therapeutic help. And I appreciate all the women that came before me, because they talked about cognitive behavior therapy. They talked about ERP. They're talking about all these treatments that when somebody is really dealing with hoarding, these are the things that they need to look at. When you walk into someone's house and you see disorganized piles or stacks of items. Now, I do remember a neighbor that they just collected newspapers. And literally, when you went into their house, all you saw were stacks and stacks of newspaper, to the point it's like you had to navigate yourself through the house. Now, everybody else saw this as a problem, but she didn't see this as a problem. And when it becomes where your house becomes unsanitary, we need to look at that too. And that's what was happening with this neighbor, because there was so many stacks of newspaper. How do you clean? You don't, it's hard to clean, and your focus isn't really on cleaning. Your focus is on, I need more newspaper. It was just years and years of newspapers. Back then newspapers were being delivered, but being delivered, or going out and purchase. Because remember, the Sunday papers used to be the thickest paper. So this neighbor would collect these and have these piles of paper. Another thing is, some people hoard when it comes to food. And then the hoarding is in there. Another symptom is when there's stuff in the refrigerator. And there's so much stuff in the refrigerator that the things are going bad. If you have a family member or a loved one that when you walk into the house and something has gone bad in the refrigerator, but they refuse to throw it away, or either, people hoard, and folks have deep freezers. And so they're holding this food in the deep freezer, and the food is becoming freezer burnt, but they don't want to get rid of it. So we need to be aware of that. We need to think of that. Another symptom could be conflict with others about trying. When there is a conflict, when you come to them and you say, hey, you have so much of this, why don't we think about getting rid of some of this? Why don't we clean some of this up? And they're like, but no, like this, who are you to come into my space and tell me what I need to get rid of? This is important to me. So we need to realize that they truly do believe that everything that they have is necessary. They believe that those 25 bottles of bleach is necessary. They believe, and there could be some emotional attachment to it, or it could just be a reminder of their past, especially the older individuals that I've worked with that struggle with hoarding. For them, it was the reminder of the past of what they didn't have. And now that they can get it, they're getting it in excess. So, we need to, as loved ones, as from people from the outside, we need to be aware, and we need to be sensitive of those things that some of those symptoms that people think. Another thing that we did mention is hoarding of animals. So, we need to be aware of that. And it's so funny because we think about the cat lady. The cat lady, everybody had a cat lady in their neighborhood. With a cat lady, she got 25, 30 cats. The house, you could smell it from the outside, but we're wondering, like, why isn't anybody doing? She doesn't think anything is wrong with that. But we need to also remember about hoarding of animals.
I am like, you are so on point, because that's what we don't think about is animals, because people do hoard animals. Good one on that one. And I did have a lady that actually, her niece brought her to me, and her niece was complaining that she was a hoarder. And the lady was like, Miss Devine, I'm really one of 8 kids, and I am the youngest one, and I never had anything new. Never. All my clothes were hand-me-down. And now that I am grown and I can purchase my own clothes, I buy clothes. And I said, okay, I said, well, let's talk about it. The clothes that you buy, are you able to wear them all? She said, I am able to wear them all, but I can't wear them all because I ain't got nowhere to go. But I like them, and they still have tags on them. I said, okay. I said, well, let's go into, can we get through your door? I'm asking these, can you get in her house? He was like, oh yeah, her house is immaculate. Everything is in one room, and that's where she keep it all. But I'm scared that she's a hoarder. I said, well, right now, what we're gonna do is support her, because she still is able to navigate, and she is saying that she wants to get rid of some of the clothes, and she will give them up. So we're just gonna support her. I said, but what we're not gonna do is harass her.
Right.
Exactly. So we don't want to harass her and just continue to tell her, what are you doing? Why are you buying those? For once, she told you. She wants to feel new clothes on her body. She wants to be able to have new clothes with tags on that belong to her. She hasn't had that feeling, and
Right.
that's what she's going through. So how do we support her? You know, and when the day that she do decide that she want to get rid of some of this stuff, that's when you go over there and you just get you something to eat and you just watch her as she go through her modeling tour and say, okay, yeah, keep, no, yes, no, just go through the process.
Right.
But
Exactly.
don't ruin your relationship trying to
Exactly.
argue with her or tell her what she need to be doing when you still can really get through her house. I think Tavara said it'll be a path. You know, you
Right.
can't get in there. You know, you like you said, we could smell the lady house from the outside. You know, the newspapers were, ain't nobody reading those papers.
Right.
It's becoming a fire hazard at this
Right,
point.
exactly.
Yeah.
And then one thing you made, I mean, Tavara, you just reiterated is that there is that path. And so when you have a path in every room, then yes, there's a problem. When you have a path in your bedroom and it just gets you from the bedroom to the bathroom because you are hoarding so many things. And again, what, you know, the thing with the older individuals is that they, like you said, with the young lady who never had anything new, with the older ones, it's like, I'm growing up and we struggled just trying to get our basic needs met, like soap. So now that I'm older, yeah, I'm going to buy 25 bars of soap, even though I'm the only person in the household. And the issue is that they may have this excessive amount of things, but they won't even give them to anybody. So if somebody was in need, they're not even, you know, oh, I need some soap. Well, you better go to the store. Well, you got 25 packs of soap over here, but they're not going to, you know, that there's value to that for them.
Tavara, did you want to say something?
Yes, I want to add something to that because also, you know, with hoarding, there can also be this fear of being sick or contaminating things. And so when a person hoard, if they place their hand on an item, they're like, oh, well, you know, I gotta buy it because, you know, if I touched it. And so, you know, since I touched it, then if I don't buy it, then, you know, somebody else can become sick. And so any item they touch, they, you know, feel the need to buy it out of fear of, you know, becoming sick. And so now you have these, you know, and then these items that are an excessive amount of items and 25, you know, honestly, you know, could possibly be probably a low number, Trish. We're talking about like someone who's has like, you know, well over 50, hundreds of items of the same amount. And so all because of fear of either they're going to lose it. I mean, they're going to need it one day. They're fear as though someone's going to become sick because they touched it and things of that nature. And so I wanted to just kind of touch bases on that because that fear of contamination is also associated with hoarding.
It sure is. It sure is. Fear of contamination or just being dirty. Yeah. And also another symptom is doubting and having difficult tolerating uncertainty. Okay. Right. We also got the needing things orderly and symmetrical. And, you know, you guys talked about that a lot. You have to have a certain same number of things or have to be in this order. And another symptom is aggressive of horrific thoughts about losing control or harming yourself or harming somebody else. So those repeated thoughts of, you know, you're going to do something to somebody or you're going to do something to yourself. And the unwanted thoughts that's what Oriante was talking about earlier, the unwanted repetitive thoughts, including aggression, and sometimes it's sexual and sometimes it's really based on religious. And it's so true, you guys. Therapy is like super awesome. We really deal with a lot of different people, and it really be amazing how people's minds are really moving. So we really want to make sure that you guys understand that obsessive-compulsive disorder is something that can be healed, but it's going to take medication. It's going to take you to be hot. And what is hot again, Tavara?
We're talking about being honest, open, and transparent. We have to be have to have those
Right.
fundamentals in order to be able to be successful in treatment, not just with medication, but also with therapy. And so again, there's a lot of components that can be associated with having OCD. We're talking about trauma, we're talking about some kind of depression, we're talking about some kind of anxiety. So this is very, very important that we're
Mhm.
Mm-hmm.
uncovering and learning about, all these things that's associated with OCD.
Thank you.
Mhm.
All right. So another related disorder connected with, thank you so much too, Trish. But don't leave me, please. Another one that that's another related disorder connected with obsessive-compulsive disorder is, let me see if I can say it. Trichotillomania. Basically, it's a hair pulling disorder. So we just be saying hair pulling, right? But when we write them notes, we writing trichotillomania. And with that being said, we're going to hear from Miss Juana Lyles, LPC of Lit Wellness Center. All right, come on, Juana, tell us what is hair pulling, but you can say the real word.
Hello, y'all. So I'm gonna break it down. Trichotillomania. So say that 5 times with me. Trichotillomania. I can't say it for real, but but yeah, trichotillomania. It's the hair pulling disorder. That's what we know it as. It's a mental disorder that involves, just like the other ladies have said, obsessive compulsive behavior. So they're recurrent, irresistible urges to pull your hair out. And the hair could be from your scalp, your eyebrows, or any other area from your body. Some of them that aren't common or that people don't do is like your private areas, pubic areas, or like in the buttocks area. But any hair, pretty much it's open game. So scalp, eyebrows, or any area on your body, like even arm hair or leg hair, okay? Now, the search for the particular kind of hair can be an issue too. So when people have trichotillomania, they try to stop doing it, but if they can't, that's when it becomes like an issue. And it can be accompanied by a range of behaviors or rituals like we've been talking about. So the search for a certain kind of hair with like a certain texture or a certain hair color. So like I have a few strands of gray. So if I was a person that had it, I might just try to find all my gray hairs and just pull all those out from all over my body. Okay. Other things is that they try to pull it in a certain kind of way, maybe. So where you try to pull it so that the root comes out so that it's intact and it looks like a, with the little hair follicle on the top and then the whole hair. So they try to do it certain kind of ways sometimes. And then the other thing about it is that people sometimes sometimes they just discard it, but it's a real issue when you're trying to like manipulate it in your fingers. Like, so you might roll the hair around. Some people even eat it. Or actually just like biting it in their teeth or just pulling it through their teeth. So it can get really, really bad as far as the rituals and the things that go with trichotillomania. It can also be accompanied or preceded by various emotional states, such like all the other OCD issues, such as feelings of anxiety or boredom, tension when pulling or resisting it. So like you get tense, if there's tension about like, I don't want to pull it, just that in itself. Also, people can sometimes have gratification, pleasure, or relief when they pull it, because sometimes you have the negative thoughts that go along with any OCDs. Like you have negative thoughts, so it's like, I got to get this hair off of me. So you feel gross or you feel like the hair is unwelcome. So you find a relief, and so it brings about a pleasure. The other thing about trichotillomania is that people can be focused on it, like, I know I'm going to pull this hair out. I know it's this specific hairs that I'm looking for. Or sometimes they don't even recognize that they're doing it. So you might just be sitting there and picking at your eyebrows and don't even recognize it. And so that's where, like what Trish was talking about, like the family members, or not Trish, but I think it was Oriente, But anyway, the family members or someone, they can track it and tell you that, like, hey, you pulling your eyebrows, you know, and you can notice like the whole eyebrow is gone. Or sometimes it's just your eyelashes. Okay. So another thing is that people don't necessarily have to pull their own hair. So we were just talking about having pets and hoarding, right? You can pull the hair from your pets, dolls. So if you recognize like a child pulling hair from the dolls and things like that, or from their little toys, it could be from your sweaters, from out of the carpet. So then, you know, the little any fibrous type of material. And I was looking on the floor because I was looking at the carpet, but like just pulling the fibers out of the carpet. So if you go to somebody's house and you recognize little bald spots in their carpet, they could be having issues with trichotillomania. And so the problem now is that hair pulling from the scalp often leaves bald spots, right? So that can cause this other distress for the person, which interfere with their work or social, because you don't want to go out with your friends because you got this big old patch of bald or big bald spot. And people might, you know, lead into alopecia. So people might think you have alopecia. You try to wear wigs or scarves to cover up those areas where the hair is missing. You just try to cover it up, and people go to great lengths to try to cover this up, Ladora. Like, I was looking more into this, and I just didn't realize the stuff that people do, like just trying to put on makeup and all kinds of stuff like that. But you want me to go ahead and talk about some of the treatments real
Yeah,
quick?
but before you do that, I
Mhm.
just want to I'm glad you brought up the alopecia, because I literally did have a client, and it was a little boy, and I literally thought he did have alopecia until I did the assessment. But just my first glance, that's what I'm thinking, that's going through my head, until I started talking to his mom and realized, no, he had trichotillomania. Say it real fast 5
Do
times.
it, girl, do it.
Okay. And so, and the reality was he had no eyelashes. He pulled them all out. He had no eyebrows. He pulled them all out. And he was working on his hair. Okay. So I'm so glad that you also brought up that is they might do their toys, their dolls. They might do the animal. And I did just see on TikTok, this man, he highlights his mom. He taking care of his elderly mom, right? And she has dementia. And he showed where he had to lay like a baseboard mat around the floor of the room in which she's in, because she literally started picking the carpet all around the edges. Okay. And again, I'm super excited that you actually is bringing more awareness to it and letting them know that it's not just your hair. And let's talk about the hair that you said, people are very particular where they pull the hair from. One reason why they might not use the private parts to pull the hair from, because it's harder to actually pull the hair from that part because people are watching. It's easier to sit in front of somebody and pick your hair, rub your eyebrows, pick your eyebrows, but it's really embarrassing and a little bit too much to be sitting in front of somebody trying to pick your pants. So, and it's a behavior that happens just repeatedly all the time. So it's like they don't have a moment to say, well, let me run into the bathroom and pull my hair right quick. No, they'll be sitting there just watching TV. And this is what the little boy would, he would just sit there and watch TV and pull his hair out. He would be in class and just pull his hair out. And so it's not oh, I'm really thinking about it, I'm doing it. It's us, I'm just doing it. It's just happening. Is that, you agree?
Yeah, that's what I was talking about. Like, you can be focused on it or just totally unaware. So that's why it's good that we had talked about our family members being able to witness that and tell us, because we might not even know we doing it.
Right. And that's how
It's
it
so
came from him. It came from his mom. Well, it came from the teacher. And then it went to the mom, and the mom was like, yeah, I don't think he even paying attention that he's doing it. And then that's why my thing was like, how do we support them? So I was super glad that was Felicia that was saying, the husband is the one that pointed out from the wife, because we have to pay attention to our family and not be like, stop, why are you doing that? You look crazy. Why are you doing it? because it's honestly, it's an issue, it's a disorder. It's coming from some type of stress that they're not really managing well. Go ahead with the
Exactly.
treatment, Queen.
Excuse me. Exactly like what you were saying. It comes from some type of stress, like the anxiety or depression. And so some of the treatments, unfortunately, the research on treatment for trichotillomania is limited, but there are options that have been found to be helpful, such as what we've already been talking about, cognitive behavior therapy. And so with the cognitive behavior therapy, you can help to identify and examine distorted beliefs that you have that's in relation to the hair pulling. Okay. Excuse me. The other one is habit reversal training. So that kind of can pair well with cognitive behavior therapy, because basically it's kind of like what I have a client, he was coming to couple sessions, and his situation was very mild. It wasn't like other people. So I brought it to his attention after the session, because I noticed during the session he'll be twisting his hair all the time, and it was because he was getting tense or anxious during the session. And so the habit reversal would just be kind of identifying, saying, hey, you got are you pulling your hair? And then they recognize it and they substitute the behavior for something else. So like maybe clench a fist every time you get ready to pull your hair. Okay. Another one is acceptance and commitment therapy, also known as ACT. And that type of therapy helps you to learn to accept your hair pulling urges without acting on them. But I also want to mention, because I am your brain spotting practitioner, okay? Brain spotting therapy would be very good for something like this. Now, the research hasn't shown that, but because I'm the brain spotting practitioner, I can tell you that it's really good for helping someone with any type of OCD, because it gets to the root of the problem. It goes way back to that subcortical part of your brain, the mid part of your brain. That's what I always tell my clients, it's this part of the brain. And it works on the theory that feelings from trauma can be stuck in the body, which leads to both physical and mental ailments, such as all these OCD disorders we've been talking about. And so the other thing is medicine that can help Glendora, but it's like the medicine type of therapies are not, it's very limited. So it's just medication for like antidepressants or anxiety that may be helpful, and that's just found to be helpful.
The thing about the medicine is that they have to keep changing it and switching it till they find something that actually works for you. And they're really trying to pair it with, and they're really trying to focus the medicine on the anxiety or the depression. So it's really very imperative that the person honestly go to psychotherapy as well. And I love the fact that you brought up ACT, and you explain it with basically accepting the fact that you have this hair pulling, this behavior, right? And then now you can go ahead and have the ability to change to do something else once we accept that this is what I actually do. Is that how you explain that again?
Mm-hmm.
Okay. Yeah. And that just took me right back into when you was like, okay, instead of pulling the hair, we're going to clench the fist. It took me right back to Felicia. We're going to refocus that attention and delay the response. So instead of pulling that hair, I'm focusing my attention on this pulling my hair. So I'm going to refocus that and clench the fist and delay my response to pulling my hair. Correct?
Mm-hmm.
Y'all, we're going to hear. Yes, it all ties together. And that's why I wanted to bring, all of you on here, because we all have different voices and we all are experts in the mental health field. And I wanted to make sure that whoever is watching us, they are able to receive what we're saying. And it might not be from me, but it might be from you or Felicia or Tavara. And it's very important that, we show up and do this, because this is how we get rid of the generational curses and we stop the stigmatisms that go along with mental health and healing. So real quick to go back over what you were saying is that basically when somebody is experiencing trichotillomania, it's really important to be mindful that it might not just be the hair on their body. It can go to their clothes, any type of fibrous material. Because I think one of the things that we as a clinician would focus on, well, what are they pulling on? They're pulling their hair out, but we gotta, so I think it's a good question for a therapist or a person that's dealing with trichotillomania to actually pay attention. As Felicia said, track. What behaviors are you really doing? Are you really tearing up that sweater? Are you really tearing up the carpet? And if you are, this is something that you may need to talk to your psychotherapist about so they can have a little bit more insight on how to help you heal, correct?
Mhm.
Yes, you did a beautiful job. I thank you. So I'm gonna bring you right back because I need you to really let us know about LIT one more time. But before I do that, let's go over to Oriante Eisen and let's hear about that emergent spirit one more time and how we can reach out and seek help from her at Emergent Spirit.
Yes, again, I'm Oriante Nicole Eisen. Emerging Spirit Counseling Services is located in Cincinnati, Ohio. And again, I specialize in working with youth as well as women, helping them to heal, change, and grow.
Give me your contact number, please.
Yes, my number is 513-788-1766.
And your website so they can just see you online.
Yes, it's www.emergingspiritcounseling.com.
Thank you so much, Queen. All right, come through, Felicia. Felicia Cameron, come through and let us know how you lend a hand.
Again, I'm Felicia Cameron. I'm a licensed clinical social worker for the state of Mississippi. I serve individuals 18 and above, help them to provide transformation in life, dealing with anxiety, depression, coping with life transition, whether it's dealing with the child just graduated from school, the retirement, just in general, or work-related issues. I help people transform their lives by providing them the tools, the techniques, so they can cope and deal with life. Look, we all have to do life, but don't let life do you. You can do this and you got to do this. My contact number is 601-317-5997. That's 601-317-5997. And I would love for you to check out my website at www.lendingmyhand.com. That's www.lendingmyhand.com. Thank you.
Yes, ma'am. Okay, come on in here, Tavara.
Hey, everybody. Again, my name is Tavara Franklin, licensed professional counselor and owner of Healing Grounds Therapy and Wellness Center, as well as your healing accountability partner, where we are cultivating hope and healing back into your life through honest openness and transparency. Again, if it is just has been just a pleasure to be with you guys today. I could have been anywhere where in your space, but you decide to come and show up and learn about OCD. Here's how you can be able to contact me. You can contact me through my website. That is www.healinggrounds.therapy.com, or you can check me out on Instagram. That is at healinggrounds_therapy. Again, if I am not the therapist for you that can be able to figure out how we can cultivate your hope and healing back into your life through honesty, openness, transparency, then I have a team of therapists who will. Please do so by checking me out or giving us a contact via phone. That is 770-558-7956. And I will hope to be on your journey of healing.
All right. Healing Grounds with an S therapy. Okay. .com. All right, Miss Noelle, please come through with Integrated Noelle Services. Come through.
Let me tell you, Glendora, this has been amazing. The energy this time of day has been amazing. Again, my name is Trish Noel. I am a licensed clinical social worker in the state of North Carolina. I am the founder and CEO of Noel Integrated Services, where we provide behavioral health and substance and addiction counseling services to individuals, families, and group. My passion is with females ages 12 to 21 who are struggling with depression, anxiety, self-harm, and suicidal thoughts. I can be reached at, my number is 919-798-7817. Again, that's 919-798-7817, or through my website, www.NIS, Noel Integrated Services, nistherapy.com. Again, it's www.nistherapy.com. And again, thank you, Glendora, for this opportunity.
Hey, I am greatly appreciative that you all are rocking with me. This is what we are meant to do. We are meant to be visible and to let people know how to heal. That's what we went to school for. It wasn't just to do counseling, but to also use our voices and spread awareness on how to heal mentally.
Exactly. And to let people know that they are not alone. And the one thing I always tell my clients, we are on this journey together.
Amen. That's right. That's right. Okay. Come on, lit. Light it up, light it up, light it up. Live intentionally. Okay. Come on, Ms. Lyles.
Again, you guys, thank you, Ms. Glendora, for having this awesome panel today about OCD. Again, my name is Wanda Lyles. I am a licensed professional counselor in this peachy state of Georgia. Okay, y'all, come through. So I specialize in anxiety, depression, and trauma. I use brain spotting, CBT, and prepare and enrich curriculum for couples. So I work with individuals and couples, y'all. And if you are ready to start living and stop just surviving, holler at your girl, because I am your brain spotting practitioner. I will help to equip you with the tools that you need in order to learn, love, and live again. Y'all, yesterday is already gone. Tomorrow is not promised. So live intentionally today, okay? And you can find me on Facebook at Live Intentionally Today. You can follow my podcast page. That's that page on Facebook. So just search it at Lit Podcast on Facebook and you can find me there. I always post up anything that's inspirational, motivational, educational, and I do have live video talks. My website is www.litwellnessctr.com. And if you want to call me, that's 334-614-8007.
8007. Y'all should be able to find all this contact information in the feed, and I hope you all are going to use it or share it out so somebody can get it. Okay. I also want to give you the Depression and Bipolar Support Alliance number. That is 800-826-3632. And American Foundation for Suicide Prevention. Remember, we talked a lot about medication, and some of the medication side effects make you want to or think about. So please understand, help is out there. American Foundation of Suicide Prevention. And that number is 1-800-273-8255. 1-800-273-TALK. Okay. And the last one I want to give you is National Alliance of Mental Illness, or NAMI. Okay. And again, that number is 800-950-6264. 800-950-6264. And I want to thank you for joining us, okay? Taking your time out and trying to hear about OCD and related disorders. I am Glendora Devine, licensed professional counselor, board certified telemental health provider. Listen, we only have one life, one. We must live. Don't get stuck in a mess of life, but get the message. If you need to reach out to me, you can at 678-212-5146. And the website is D and David, S and Sam, Georgia spelled out, .com, dsgeorgia.com. Ladies, come on and let's wave goodbye. And thank you guys for again tuning in. But this is a dynamic crew on fire, and we really appreciate you guys tuning in. And if you need us, reach out to us. We are here to help. We are visible.